So, my name's Ben Hannigan and I work in the School of Healthcare Sciences at Cardiff University. I'm a professor of mental health nursing, and the kind of research that I do is investigating mental health systems and mental health services. So I ask questions like how do we organise services? How are they delivered? What are the experiences of people working in and on the receiving end of those services? And I particularly try to make connections between national policy contexts, so the large-scale framework for how we think we ought to provide mental health care, and then what happens in local services, local organisations and local teams, and then burrowing right down to the smaller scale, what then are the experiences of people who are both providing mental health care at the face-to-face level and receiving mental health care. And it just seems to me that in that kind of research, you have to work with people with lived experience of mental health difficulties. You have to have your questions and your design and your methods informed by people who have experience of using services. And I think that's an important principle and a really important practice. And I could give you a couple of, in fact more than a couple actually, of examples of how we've tried to do this. So COCAP and COCAP-A were two big studies funded by the National Institute of Health Research, Health Services and Delivery Research Programme. COCAP stands for Collaborative Care Planning Project in the Community, and COCAP-A was Collaborative Care Planning Project Acute in Hospitals, that's right. And in both of these studies, and they were kind of partner studies if you like, they were funded at around about the same time or in quick succession. We were interested in investigating how care plans are developed, how they're written, how they're produced, and how care is coordinated, and what the relationships between those processes are and people's experiences of recovery and of their care being tailored or personalised or made bespoke to them. And what we did in COCAP and COCAP-A were a number of things to realise the principle of properly involving service users from the off. So the project team included Alison Faulkner. Alison is a mental health service user, an activist and independent researcher. She was funded as a full co-investigator. The study as a proposal, so COCAP was the first of the two studies to begin, so when that was being developed it was in a fit state to be shared more broadly. That went to a service user lived experience group, a bit like the PAR group. It's the sugar group that exists at City University in London, and just as PAR is now modelling, so inviting researchers to bring their ideas to get a service user view, the Sugar Group in London has been doing that for many, many years, so we took our proposal to that group and incorporated what people there said about how the study should be designed, the kind of methods we should use and so on. Once the study was funded, we established a lived experience advisory group, so we had a standing group of people with personal experience of mental health difficulties and of using services who advised us throughout the lifetime of the study, from as soon as we were funded right through to the close of the study and the beginning of our dissemination strategy. And we also, in our grant, had a sum of money to employ people with personal experience of mental health difficulties who came to work here in Cardiff University. So in the Wales-based part of the study, two people came to work with us, two members of the PAR group actually, and they were qualitative researchers, they were field workers. So I would spend some of my time with a service user researcher colleague who would visit people using services. I might interview a carer to talk about their experiences of care planning and care coordination. And Alan or Bethan, who are the two service user researchers, would then interview the person who was receiving care. So and we did pretty much the same model for COCAP-A, which is the acute, the hospital-based study. So that's a really good worked example of how, from the lifetime of the study, in fact, from the very beginning of thinking about it, right through to its completion, how researchers, people with personal experience of mental health difficulties work together.